Let's talk about skin cancer. As you're probably aware, all cancers, are caused by abnormal cells in the body that divide uncontrollably. So whether it be skin cancer or lung cancer or ovarian cancer, what they all have in common is they're a disease of the cell cycle. And what happens is something causes these cells to lose control of their cell cycle, and they will divide and divide and divide uncontrollably. And we've all been affected in one way or another by cancer, whether it was a family member, a friend, or yourself. And skin cancer is a major concern in our country. In fact, it's about a half of all cancers diagnosed in the United States. About 1 in 5 Americans will experience some type of skin cancer in their lifetime. We're going to discuss the 3 types of skin cancer. And what we're going to focus primarily on is the difference of the 3. Now, all cancers have certain risk factors, whether it be genetic, exposure to chemicals like in lung cancer and smoking. And I think we know the number one risk factor for developing cancer. It's exposure to UV light. And there is one other minor cause, which is frequent irritation to the skin. So you typically don't think of that. But in both these situations, the cells of the skin are becoming irritated, whether it be by UV radiation or a type of friction on the skin. And those cells have to divide in order to repair that tissue. And as they divide, that's when the increased risk of making a mistake in your cell cycle can occur. We're going to talk about the 3 types of skin cancer. Again, collectively, they make up about half of all cancers in the United States. Basal cell carcinoma makes up about 78% of skin cancers. Basal cell carcinoma, therefore, would be the most common form of skin cancer. It occurs at the stratum basale. So if you recall, the stratum basale is the deepest layer of the epidermis. These cells will then begin their abnormal cell division, and they can actually invade into the dermis and even the hypodermis. But what they don't do very often is metastasize. Metastasis is when the cells will actually leave that area, travel throughout the body, either in your lymphatics or blood, and set up a secondary tumor in some other distant organ. So basal cell carcinoma doesn't typically do that. It's caused primarily by skin exposure to sun exposure. There are some other causes. Arsenic is very toxic and it can cause cancer. Open sores, tattoos, and burns can increase the risk of developing basal cell carcinoma. The treatment is surgery. These tumors, again, typically don't spread to other areas, but we can surgically remove them. We can also use what's called cryosurgery, and in some cases we can use a topical chemotherapy. But surgery works very well for this cancer as long as you get the entire tumor. If it has invaded the dermis and hypodermis, that, as you can imagine, becomes tricky, and you might need to do a skin graft to replace that lost skin. Squamous cell carcinoma is the second most common skin cancer. It makes up about 20% of all skin cancers, and it arises from the stratum spinosum. So that's that second layer above the stratum basale. This cancer is more aggressive than basal cell carcinoma, but less aggressive when you compare it to the third, called malignant melanoma. Squamous cell carcinoma is most common on the scalp. ears, lower lip, and hands. All areas of the body that get the most exposure to sunlight. Treatment can be radiation, but also surgery. It just kind of depends on the extent and the technique the dermatologist chooses. Finally, malignant melanoma. It is by far the most aggressive form of skin cancer, but it only makes up about 2% of all skin cancers. The risk of developing melanoma in your lifetime is about 1 in 75. This number has increased dramatically over the years, largely due to erosion or depletion of the ozone layer, but also the increased use of tanning beds and exposure to sunlight. It's a cancer of melanocytes, as the name suggests, with the melanoma. It metastasizes to distant organs like the brain and liver, and is very resistant to chemotherapies. So this cancer is very dangerous. It's very aggressive, and like all cancers, the most important thing is to detect it early. There are some things that dermatologists and everyone should be looking for. We use the acronym ABCDE. This stands for asymmetry, borders, color, diameter, and evolving. So they look at the edges or borders and whether the tumor is symmetrical or asymmetrical. So this would be an asymmetrical shape. They look at the color. The color changes, kind of the variety of the different pigmentation in the tumor. They look at the diameter, which is simply the size of the growth, and then whether it is evolving or changing is another key indication. The risk factors of developing cancer, again, would be sun exposure, your skin type, so whether you have light colored skin versus dark colored skin, so the amount of melanin that protects you from UV light. Family history. Certain families have higher risk of skin cancer. Age. Older individuals are more prone to skin cancer because of their longer total exposure to sunlight. And then finally, the immunological status of the individual. So some individuals might have a suppressed immune system, which increases their risk of developing cancer. Next thing I want to quickly go through are burns. There's a number of things that cause burns. Heat, radiation, electricity, even chemicals like acids and bases. Seriousness of a burn largely depends on how deep it has burned the skin, the extent, so how much of the body has been burned, what specific areas, and then the patient's health status, if you will. We'll go through the 3 degrees of burns. First degree burns are fairly superficial burns in that they only affect the epidermis. So your basic, well, I guess this isn't quite basic, this is pretty extreme, but your typical sunburn is a first degree burn. Localized redness, some swelling, and can be painful. Second degree has dermal penetration, so it can burn and damage parts of the dermis, which can lead to blistering, increased risk of infection, and possibly scarring. The key difference between first and second degree burns are the sign of having blisters. Second degree burns will heal on their own without the need to graft unless there's a severe infection that can take over that area. So that's the biggest concern, is infection as well as dehydration, depending on the extent. Third degree burns is the most life-damaging and threatening. Deep tissue damage, complete destruction of the nerves in the skin, dramatic dehydration and electrolyte imbalance, which can possibly lead to circulatory shock. So by far the most dangerous situation with burn victims is severe dehydration. Obviously, we're still concerned about infection And typically we have to replace that lost skin using skin grafts. Skin grafts is an area of a lot of new research to develop better ways to replace that lost skin. These are some just images again showing your drawing of the skin, first degree, second degree, and third degree, penetrating even deep into the subcutaneous regions. Finally, I want to talk about what's called the rule of nines. The rule of nines is used to estimate the percentage of the body surface that might be damaged by second and third degree burns. We do not include first degree burns because first degree burns don't have the impact on the hydration of the patient like second and third degrees do. The reason why we do that is to determine the extent of fluid loss. So again, most important thing is to try to determine how much fluid has been lost and therefore replace those fluid and electrolytes by IV. If it's determined that over 25% of the body has second degree burns and or 10% of the body has third degree burns, the patient is said to be considered in critical health. A little bit different when we deal with children and older individuals. These individuals are much more susceptible to the dehydration, so the rule of nines doesn't quite apply exactly to younger children and older individuals that might have weaker immune responses. So how do we do the rule of nines? If we look over here, all these numbers are largely based on the number 9. Here on the right is if we consider both the anterior and posterior areas. For instance, both the anterior and posterior head and neck make up 9%. Therefore, just the anterior side would be 4.5%, just the posterior side would be 4.5%. The entire anterior and posterior shoulder, arm, forearm, and hands is 18%. That includes right and left. If it was only one arm, anterior and posterior, it would be 9%. If it was only the anterior surface of one arm, it would be 4.5. So we have 4.5, 4.5 on the anterior arms, 4.5 and 4.5 on the posterior arms. So that would be a total of 18% for both arms. The anterior and posterior trunk equal 36, so just the anterior is 18 and just the posterior is 18. The genital area contributes 1, and then the legs, both legs, front and back, contribute 36. So it would be 9% on the entire anterior of one leg, 9% on the total anterior of the left leg, or the other leg. Therefore, 9 and 9 is anterior, 9 and 9 is posterior. That is a total of 36% for both legs. So knowing this, you can be given an example and determine the total percentage of the body. For example, the anterior surface of both arms would be 9% total. The anterior surface of the trunk would be 18%, so that would total 27. If we had first degree burns on the head and neck, second degree burns on the front and back of both legs, it would be 36%, because we do not include this first degree burn on the head and neck. So we only look at the front and back of both legs, which if we look over here is a total of 36%. So this is how we can, again, calculate the percentage of the body surface damaged by second and third degree burns in order to help us determine how much fluid may have been lost.